Good morning and welcome to The Point. It is Wednesday, September 16th, 2020. Thank you to those of you joining us across the various platforms. We appreciate your viewership and listenership. Thank you for joining us this morning. Our guest this morning, Minister of Health, Honorable Nickolas Steele. He's here to provide a bit of an update for us on this morning's program. Good morning, Minister.
Good morning, Blossom. Good morning to all of
Thank you very much
your
for
viewers and listeners out there.
Thank you very much for being our guest this morning. I know it's still busy time for you very much, so we'll get right into it. In yesterday's postcab, you facilitated...
Yes, it is busy, but always up.
Thank you. I appreciate that. In postcab yesterday, you facilitated post-cabinet, and one of the high points or one of the highlights of the briefing relates to the revisiting of protocols as it relates to Grenada's COVID-19 fight. Should remind us or reiterate for us what those revisions may look like.
Yes, well, to start, we have no new positive cases, we have no current cases, and we have no deaths. We continue to monitor each and every aspect of our response to COVID. So we evaluate and re-evaluate, for instance, our protocols and our decisions with respect to schools. Schools are reopening now where schools were closed previously. Most businesses in Grenada, most are open in some form or fashion, either reduced numbers or so, but open. And this is constantly evaluated as well. Our agricultural sector, but biggest segment is our domestic sector, and the biggest segment of our domestic sector is our hospitality industry. So these new protocols that we're looking at adjusting are specific to our hospitality sector to allow a further opening of our hospitality sector. Along the guiding principles that first and foremost, we're here to save and protect lives, but also to protect livelihoods.
Over the past few weeks, we have seen varying degrees of the virus in different countries, as near as Trinidad and Tobago, as far as other parts of the world, the US, the UK, and so on. How has that affected how we have responded in trying to keep the virus out of our shores?
Well, we have a protocol in place for persons coming to Grenada from areas where the virus is the levels of infection are high. So the fact that while we are very sorry and our hearts go out to our brothers and sisters in Trinidad, the protocols that are in place just simply now include people coming from Trinidad, and we monitor. For us, it needs a little more due diligence because we have that much more trade and communication with our neighbor to the south, but the systems are in place.
With the revisiting of the protocols in the wake of the reopening of MBIA, most of us, and I say us, including myself, we are a bit still apprehensive that we're opening to parts of the world, but we're still opening in here locally, which may encourage more movement than we currently see. Do you think it's the right time to revisit that, considering the virus is still very much prevalent in other parts of the world?
Can you repeat that question?
I was asking, as we've reopened MBIA, do you think it is wise to continue to revisit these protocols, which just may encourage more movement here locally? Did you catch that? Just for the sake of our viewers and listeners, yes, can you hear me, Minister? Minister?
Yeah, just by. Let's try that again. Blossom, what was that?
Let's try that again. I was asking if you think it is wise to continue to revisit these protocols now that we've reopened MBIA, which just may encourage more people, more movement here locally. Even though we're COVID-free, there are still countries with the virus who may be coming into the island as MBIA is reopened. Do you think it's wise to continue to revisit at this time? And we've lost him again, I believe. Just for the sake of our viewers and listeners, Minister Steele is not in the office.
We constantly need to revisit. To revisit any and all of our protocols. Can you hear me?
Yes, I can. Go ahead.
Right. So revisiting the entry protocols is a ongoing event. We in June, when the rest of the OECS and CARICOM opened, we basically had said we would not go ahead with the level that, for instance, St. Lucia and Jamaica were going to go ahead with, or Antigua. But we would be a bit more reserved because we had the ability, economic-wise, to help subsidize our industry, but keep it closed. And we would observe what they were doing, and if what they were doing worked, then we would follow to a fashion, and if not, then we would adjust accordingly. Well, we have observed, and St. Lucia, Jamaica, Antigua have been open. We look at St. Lucia and Jamaica, and we see that they, to date, have not had a single individual, national or resident or citizen, infected from individuals coming in for the tourism trade. Not one. They have monitored. They can proudly say so, and that their system does work. And we're satisfied with the time that has passed and the observation. St. Lucia's had almost 6,000 individuals come in. So having seen that, we find ourselves able to say, okay, we can adopt some best practices that we see coming out of St. Lucia and Jamaica in particular. That doesn't change the fact that whether we have our borders open or closed, or the degree to which they are open, doesn't change the fact that in any country in the world, there are certain European countries that have reopened. The issue is not reopening. Reopening is a must. The issue is not following protocols. If we maintain our social distancing, if we keep functions and gatherings to a certain level, unless we take the additional measures, etc., then we will get through this. In all the countries where the same, Jamaica is a perfect example. Through the tourism trade and opening up to facilitate its hotels, etc., there has been no cross-infection or infection of citizens. It is ourselves. We do this to ourselves by not following protocols. So that is the risk there. The risk is not in opening up. The risk is in we not following the new norms.
I've also learned that CARICOM heads have taken the step to agree to a travel bubble with countries in the region. Explain to us what that means for regional travel between islands.
For us and other CARICOM countries, some CARICOM countries, there are 0 cases, and we are quite comfortable with the protocols that each of these countries have with respect to entry protocols and with respect to domestic policies of social distancing, etc. And as a result, we have decided, in the spirit of CARICOM and in recognition of this, that there would be the free movement, so to speak, with respect to COVID protocols, free movement of individuals between our countries. There would not be a requirement for quarantine, and in most cases, there would not be a requirement for pre-testing or testing on arrival if you're coming from one of these countries.
Are we concerned, or how concerned are we that this may be ticklish time? And I ask that on the heels of just the past few weeks, we've heard reports of 2 cases, well, that I am aware of people passing through Grenada to get to other islands, and when they get to the other islands, they test positive for the virus. I recall one that entered St. Lucia a few weeks ago, and just maybe about 2 weeks ago, I saw a report of 2 foreign nationals that passed through Grenada to get to Barbados testing positive in Barbados. How concerning is that situation may reoccur?
In both of those cases, the most recent case in Barbados, this was somebody trying to get to Grenada from the UK, and when they got to Barbados, Barbados tested them. So that's we as a CARICOM region, us, Grenada, Barbados, and so insisting that individuals pre-test and or test on arrival. Now, the individual did not pre-test or had a negative pre-test and then tested positive in Barbados. The other incident that you're referring to was persons who came from Italy to Grenada. They tested negative in Italy. They tested negative in Grenada, and then went on to St. Vincent, and they tested positive in St. Vincent. Now, we see that as one of two things. Either, as we have always said, the virus has an incubation period, which is why we have the quarantine and the observation period, not just a simple test. And two, there is also the phenomenon of shedding, which is an individual who has had the virus months ago or so. Every now and then, with a PCR test, you can show positive because the PCR test is that accurate that it is picking up dead virus particles. So it's one of those incidents, but we take all of the necessary precautions. As a result of the person testing positive in St. Vincent and the fact that they were here in Grenada previously, we immediately tested everybody that was in the hotel and everybody that dealt with them at the airport, etc. And everybody was negative. So it shows that you can be dealing with people with COVID. You can have individuals in your country, at your hotel, at your hospital, who are COVID positive. And you will not get COVID if you follow the proper procedures, which is what we have been telling everyone in the nation. If we follow the proper procedures of wearing masks, social distancing, then we will be safe.
Speaking of regional travel, there have been conversations about the difference in the cost of testing when you get to or leaving an island. There are some islands that have it for free. There are others that you pay what can be termed a little amount. There are some whose price is a bit higher. Can you explain why there's this, for lack of a better word, inconsistency in the cost of testing across the region? Why it's not a uniform standard fee for travel?
Each island has different financial realities and different priorities. And so the level of subsidizing that a government does on its testing is for each government to decide. So that would explain the variation in pricing. But there's one consistency. If you ask any of the islands how much it actually costs, it's the same. It's just about the same, about 150 to 160 US dollars per test.
One of the latest developments as well relates to your ministry, as announced by the Prime Minister over the weekend. Cabinet reshuffle. You will now have the assistance of Honorable Delma Thomas, who will be in charge of hospital services. How does that help Grenada's health system?
Well, I think it shows a priority of putting two
sorry, Minister, could you repeat? We lost you there for a bit. Still not hearing you, just in case you can hear me.
Have the personal attention of Minister Thomas dealing with the hospitals. And as we proceed, apart from the added stresses that I've had and my ministry has had with COVID, we also need to now recommit to the various other priorities, for instance, national health insurance. And it would have been very difficult to have proceeded as one individual to maintain this level of due diligence with COVID, to proceed with our phase 2 as we're going full steam ahead with a phase 2, to proceed with our imaging, dialysis, and national health insurance. So I welcome the assistance and look forward to Delma and I working together on this.
There was a question on the WhatsApp. Right. I'll just switch it a little bit. There have been comments from members of the public.
Awesome.
Yes. Can you hear me, Minister?
I seem to have lost your audio, or you're on mute.
No, I think we're the same. Can you hear me? Can you hear me, Minister? Okay, while we sort that out, let's take a quick break and see if we can adjust our audio here a little bit. This is To The Point on Classic and GBN. We'll be right back.
Reading is too hard. Reading school books is lame. I'd rather read about children like me and cool things. I can read, but sometimes I don't even know why I have to. It makes no sense.
Why can't we read about things we like?
Reading is the key to unlocking all learning and ensuring that children reach their potential. Here's what the children have to say.
Make reading fun.
Teach me how to read, but let me practice reading with things I like to read.
Talk with me and read with me at least for a short time every day.
Let me tell you my own stories.
Read, learn, grow. The children are the future. Help them read, learn, grow. So parents, you play your part.
This message is brought to you by the OECS USAID Early Learners Program, funded by United States Agency for International Development.
Get away from your daily stress with a Grenada vacation at the Koyaba Beach Resort. Koyaba is located on the world-famous Granance Beach and boasts 5.5 acres of beautiful garden. We offer excellent service, good food and drink, well-appointed rooms and friendly staff in a safe environment. Facilities include 2 restaurants, 2 bars, swimming pool, water sports, tennis, gym and body treatment rooms. Call 473-444-4129.
Welcome back to The Point, speaking with Minister of Health, Honorable Nickolas Steele, giving us some updates as it relates to everything health-wise. I was about to say COVID-19, but everything health-wise. Minister, before we went to the break, I was about to ask, there have been comments from members of the public in relation to the need to continue with the protocols and regulations, and we do not have any known active cases. Have you heard those rumors, and how would you respond? Not rumors, those conversations.
Yeah, I've heard people say, well, we have no COVID in Grenada, so why do we have to curtail our activities? I'm sure there were people that said the same thing in Europe when they decided to reopen. They are most definitely, I would say, us Turks and Caicos, people in the Turks and Caicos about that as well, as people in Trinidad about that as well. The threat of COVID remains, and the threat to Grenada continues to be high, and as such, because as long as there is that threat, we have to take the necessary measures. Trinidad was at 0, and it's out of hand now. I'm sure people in Trinidad would have been saying the same thing. Turks and Caicos was at 0, and it's out of hand now. So we cannot just simply rely on the fact that so far our governments have been doing a good job and been able to protect us at the borders. So therefore, I can just run amok and do as I please internally. Because I'm saying that your government is not perfect. That those at the ports, while they are providing an amazing job, they are not perfect. And it is possible for them to make a mistake. And if they were to make that mistake, we need to make sure that there's a second level of defense, which is, as long as that threat exists, that here we take the necessary measures in our society to minimize, if not prevent, the spread of COVID-19. And that's what I would say to them. Look at the examples of other countries where people may have been saying the same thing that they're saying, and they need to be that added level of defense.
You say that, and my mind went back to the travel bubble, where we can have an instance of moving from 0 to 160 seconds. So with the protocols in place for the travel bubble with no PCR tests on arrival, how would we ensure that Grenada, for instance, does not have a case of getting out of hand? Yeah.
Well, that is the difference in policy. We are saying that within that travel bubble, within the hospitality sector in particular, the necessary measures are being taken to protect workers and workers' families and all of those who interact there at the hotel. And what we need to do is to find that balance between protection of lives and protection of livelihoods. And it's gotten to the point now where our efforts in protecting lives have worked. We're not about to throw the baby out of the bathwater or throw caution to the wind, but we have looked at best practices elsewhere and see it possible to adjust so that livelihoods can be protected as well. And that is why we would implement that protocol that would allow for some of the hotels to reopen under controlled environments as well, and allow those who work in our hospitality sector to go back to work, allow those in our agricultural sector who provide to our hospitality sector to get that added income, so allow more economic activity, i.e. across the board now, more protection of livelihoods. Because we have got to blossom, we have got to learn to live with COVID. We've done a very good job of preventing COVID from coming in here, and we'll continue to do so as a nation. But we have got to learn to live with this COVID threat and find the best way possible to do that.
With the revision of protocols, before I go to our viewers and listeners, with the revision of protocols, would we see any quote-unquote new businesses given permission to reopen their doors? Maybe like the movie theater, and I'm sure there are a few other businesses that have not yet been given the green light. Is that something that is in the near future?
That is our intention and our desire, to have as much as possible, if not all, types of businesses open in some form or fashion. So yes, I do hope to see movie theaters at some point. I do hope to see the other businesses that are still closed, an opportunity for them to reopen. I had discussions on Friday with individuals in the entertainment hospitality sector, so restaurants, bars, nightclubs, and so, to find a model for them to safely open. And that is our intention throughout, across the board.
At this point, I would open the platform for viewers and listeners who may have questions for Minister Steele. Please keep, those of you who are calling, please keep your questions to 1 minute or less in the interest of time. There are quite a few questions already on the WhatsApp and Facebook coming in, so I know people would have a lot to ask the Minister. So please keep it as short as possible. 435-2041, that's the landline. It's also the WhatsApp. You can also pose your questions, comments, queries, concerns on the GBN Television Facebook page and the Grenada Broadcasting Network's YouTube channel. Let's go to our first caller. Good morning, caller.
Yeah, good morning, Blossom, and good morning to public servant Nickolas Steele, because I pay his salary and he's accountable to me, and he's a public servant. I want to find out, Servant Steele, in relation to the hospital and the National health insurance. We have not heard about that. And we don't want people to be using COVID as an excuse. Because when you look at the situation in the hospital, it stinks. Only recently you're hearing about the ambulances not coming on time and somebody happened in St. David's and all kind of a problem you're hearing in relation to the hospital. And I think it's time that we get our priorities right. Yes, we know that revenue has fallen, but you have to check on your priorities and fix that hospital and the health services in Grenada because it stinks and we need to know how betterment, we're looking for betterment in the hospital and stop all this monkey trick and this stuff. We need better.
Thank you very much, caller. Minister Steele?
But, Blossom, I think the caller needs to get up to date. On Sunday, there was an announcement of priorities, and you asked me the question as well. We have an additional minister for hospital services. There's a recognition that there's a need for improvement. We have done a lot at the hospital, but there's a lot more to be done. The complement of ambulances at full, and there are more ambulances still that are coming. The phase 2 is well to be completed within the next month, and with the imaging facilities. So there's quite a lot, but there is a recognition that more has to be done. And as a result, this government has put further priority by having an additional minister in health and one specific to hospital services. So I think the caller needs to get up to the times. Should have listened maybe to the Prime Minister's address on Sunday, and would have had that answer. And also, I think that the caller is just being vague and unfair to the healthcare workers there, and to refer to the hospital situation as stink. And so I think that's very inappropriate, and I will defend the healthcare workers to say that they are doing their best with the limited resources, and we as a government recognize and have put the additional manpower priority, so to speak, all the way up to the ministerial level.
Thank you. Back to the phone lines. Good morning, caller.
Yes, good morning, Blossom. I must first say congratulate Mr. Steele for using one good word, that COVID is here to stay, and we just live with it. I congratulate you, and that's quite true. Because take, for instance, dengue is wrong, but it's not spreading. And if everybody do what they have to do, I think we could get over that COVID. Thank you very much, my dear.
Thank you, caller. Any responses, Minister Steele?
Well, just to thank the caller for that. And yes, the caller is right that COVID is here to stay. We need to learn to live with COVID. There may be down the road a vaccine, but time will tell on that. And his reference to dengue, we're not out of the woods with dengue either. There is, throughout the OECS, we've seen a significant increase in the vectors, in the mosquitoes, because it's a significantly active rainy season this year as well. So we need to take those precautions for the spread of dengue on top of that. And the way to tackle that is the same way that we have tackled COVID. I hope that every citizen has learned that lesson from COVID, that with any disease, any communicable disease, it is not just the Ministry of Health or the government that has to fight it and get rid of it, but we must all do our part with respect to our lifestyle or our behaviors, putting ourselves at risk with the disease, the particular disease, COVID-19 or dengue. Dengue, we need to work together to prevent the breeding of mosquitoes around our surroundings and to use repellent if we are in areas that there is mosquitoes. And it's not simply the government has to fog, and I can continue to create opportunities for the mosquito to breed and just pass all the blame and all the responsibility onto the government.
Good morning, caller.
Yes, good morning, my dear. How are you?
I'm good.
I'm not too good at all. Yeah, I don't like how that lady called Mr. and speak to us now, Miss Avon. She must have respect for people. She don't have children, but she has nieces and nephews. I shouldn't like the way to talk to them like that. If she can't say something good, don't say nothing at all. She's too out of place.
Thank you very much, caller.
Okay? Yeah, I must have more discipline than that.
All right, thank you. Minister Steele, there's a question on the WhatsApp. As we are still battling COVID, the people placed trust in Dr. Martin and Dr. Mitchell. Can you tell us where they are now and what they're doing presently? Because we miss hearing them on the regular.
I will pass that message on. I'm sure maybe they're listening. Dr. Martin is very much there. Dr. Martin is now the acting permanent secretary in the Ministry of Health. I think it's a wonderful opportunity and a promotion on his part to have somebody, a medical doctor who has worked their way up the ranks from junior doctor all the way community, etc., who is now the chief administrative officer of the ministry. And Dr. Mitchell is also very much around. The advisory committee still functions, but Dr. Mitchell has gone back to his private sector life primarily, but is still around as an advisor, very much so. I speak to Dr. Mitchell almost daily, and he interacts with the Ministry of Health still, although he has reverted to his private sector life. Dr. Mitchell is enjoying his retirement.
Another WhatsApp question. What's the ministry's take on the data coming out of the UK showing a doubling of COVID-19 cases every 8 days or so?
We observe, and we hope that they will be able to get it under control. I think if there's a lesson to be learned there, we need to look at the steps that the UK has taken with the last iteration of regulations, no gatherings above 6, etc. These are along similar lines that we have been speaking to in terms of maintaining protocols when you are outside, when you are outdoors and so on. And the choice as a nation is that you either are lax and then will be forced to become even more stringent, or you find a tolerable level and maintain that level as long as the COVID threat exists.
There is another WhatsApp question before I go back to the phone lines that is asking, when will flights resume from the U.S.?
I believe flights would resume from the U.S. Sometime in October. That is the intention with this new protocols that we are putting in place. But most of the airlines are private entities, and it will be up to them. All we can do is to try to create the environment. But I believe that by the first week of October, we can see regularly scheduled flights coming out of the U.S.
Good morning, caller.
Good morning. How you doing?
I'm good.
I want to ask the minister about, you talk about the protocol, right, and keeping all the guidelines in place. There's a trend that's taking place right now with bus trips. You know, number of buses going on bus trip, and nobody wearing masks, and everybody's having fun, who drinking, who driver drunk, everybody having fun. What about that? What does the ministry think on that?
Thank you, caller. Minister?
It's very disappointing sometimes when certain members of our society refuse or ignore the protocols. I'm not going to single out any particular area, but the caller did say that buses or certain bus drivers, and that is disappointing. The bus drivers on the whole provide an essential service to the nation of transport, and it must be done responsibly. It must be done responsibly under these COVID times, and must be done responsibly before and after COVID. So you refer to the wearing of masks, etc. That we have to self-regulate ourselves on that too. As the passengers on these buses, we must speak up and speak out as well. And the police, we are working with them for them to get the necessary strength to enforce that. But as you are very much aware, it's happening when there's someone who is non-compliant. They make a concerted effort to be non-compliant and to evade the efforts of the police also to monitor. So the activities that are not allowed, they will do it around the corner. They will do it just before they get to St. George's. So that is whether it is not stopping on a bus stop or not stopping in certain areas that are specifically have been designated that way. Overloading with respect to now the COVID regulations of the number of people on a bus. You have individuals making a concerted effort to go against, and therefore the way to enforce is, do we have to put up a police officer on every single corner, on every single road that buses ply? Because when you have police monitoring at the terminus, and randomly the bus drivers are communicating, or those who choose to be non-compliant and waiting till they get around the corner to overload or offloading people before they get to where they know a roadblock is or so. And this is not all of them. I know there are many bus drivers who recognize the responsibility and respect it and are doing their best. And we also have members of our society who are traveling on the buses without masks, or who are not complaining about that. So I think we all need to step up our efforts in terms of regulating this essential part of our lives, which is the transportation of our people. We have our kids going back to school now, and they're innocent kids traveling on buses, and we as citizens, not just the government alone or the police alone, we as citizens have to make sure that our children are transported safely with respect to speed, safely with respect to intoxication of driver or non-intoxication of driver, and safely with respect to the COVID requirements. We need to do this together. It's not just something that the police alone have to do. We have to do it together. You see a bus doing it, speak out. We have radio programs. Call the number of the individual. Post. Social media allows us to take pictures of people committing offenses and embarrass the person into compliance. Let us work together as a society to do this.
Back to the phone line. Good morning, caller.
Good morning. I'm very much concerned as to what is happening in Grenada. Not it seems to me. I know to some extent that the people in authority, well, I wanted to use the same word, seem not to understand what they are saying. They are not carrying out or trying to get the authorities whom they have to put into action to do what they say. In other words, to obey the laws of the COVID. For example, there are funerals, which I think maybe I had thousands of people in the funeral. And yet for all, I think they said it could be 25, 20. I don't know if it go to any amount now, or any number, because I'm wrong by saying amount. Amount is only used for money. And although everybody's saying it, I don't take what they say. I do what is right. Now, as far as I'm concerned, something is wrong with all of us in Grenada. It could be in the force, it could be in the leadership, because if the leaders pass laws or they make law, somebody has to carry out the law.
So, caller, sorry, what's the question, please?
No, look, the question you're looking forward, or you want comment?
So
no,
it's a comment? Because your 1 minute is up. So just wrap up quickly, please.
Well, look, something is wrong. You all have a right to get the people who in authority supposed to do things to do it, so that don't come and complain about the people doing that and the people doing that. This is why you make law. Although they say the laws don't have no teeth, they don't have teeth in the laws in Grenada. I don't understand what they mean. Better they put gum and then put artificial teeth. It's time that they have teeth. The laws have to have teeth.
Thank you very much, caller.
Blossom, my response there is that I continue to have faith in our Grenadian people that we will do the right thing. We have done it generally, getting through this COVID. And we don't need to have a police state. I don't believe that it is necessary to have the police on every corner or to enforce common sense regulations or so. I do believe that we need to rely on those of us who know better to inform and assist those of us who choose not to comply.
There's a Facebook question. Grenada is not on the list of 100 safest countries, and that is because of our inability to deal with an outbreak of COVID, because of our poor healthcare system and heavy dependence dependability on tourism. What can you say to the Grenadian people to give us a little hope and help us feel safe in the process?
But I think the caller is mixing up different facts or realities there. No offense to the caller at all. But we are one of the safest countries in the world with respect to COVID right now. We have a health system that is in need of strengthening, and that is one of the reasons that we took the harsh measures. I was the first to come out and say, because of the lack of infrastructure that we have compared to first world nations in our health system, that we had to close our borders, that we had to take those necessary steps in the beginning to allow us to prepare and to minimize the risk as much as possible. And we continue to do that. It is always in a recognition that as a developing country, we do not have the type of infrastructure and so that exists in first world nations. And also with a recognition that even with the best health systems in the world, those countries are having problems and there are deaths and widespread community infection of COVID-19 there. So we are very much aware of the realities. And as a result, that is why we can see that Grenada is one of the safest places to be with respect to COVID, as long as we continue to adhere to the policies and procedures that have been put in place.
A WhatsApp question, Minister, what are you doing to upgrade Karaku's health situation?
Karaku's health situation is continually being upgraded. If anybody goes there to the Princess Alice Hospital now, they will see it's under renovation and upgrade. There is an X-ray machine on the way to Karaku as soon as the facility is prepared for it. There's strengthening with respect to doctors. There are scholarships that were recently awarded, and we made sure and we continue to make sure that individuals from Karaku get their fair share so that we have people who are from Karaku trained consistently in the medical profession to return to Karaku to provide that much needed service as well. So we're constantly looking at Karaku, as we are with all aspects of our primary healthcare system, to improve it. And that is also a recognition when Minister Delma Thomas was recently appointed or named to take on the duties of hospital services. That includes Karaku as well. I would expect to see Minister Thomas visiting Karaku and helping to push ahead the initiatives that are already in place for the improvement of healthcare in Karaku and Grenada at large.
Back to the phone.
1.5, just to give you that figure, $1.5 million is being spent at present in the upgrading of Karaku health facilities, Hillsborough Health Center and Princess Royal Hospital, sorry.
All right, back to the phone lines. Good morning, caller.
Good morning to you, Madam. Good morning to you. I hope you're having a wonderful morning. And good morning to Minister Steele. Good morning to you. And how are you this morning? May I say, Mr. Steele, congratulations to you. Oh, I congratulate you very, very much for informing the public during the COVID time. You was very, very informative, keeping the nation abreast. So I thank you very, very much. And I'm proud today to be a Grenadian, to be under your watch, making sure that we are safe here in Grenada. Look at the country abroad. All of them, they're suffering. And they're talking about the hospital. I find the hospital do a very wonderful service to the people. Everywhere you go, I've been to places abroad, and there is always problem in the national health. We are no exception. For you, Mr. Steele, I thank you very, very much. You're doing a great job to the Grenadian people. And I also welcome your partner, your co-partner, who will be helping you along. You do need a bit of help. So I thank you very, very much. I'm proud to be a Grenadian. You have a wonderful day. And I wish you all the best. Yes? Bye-bye, my dear. Bye.
Thank you, caller.
I want to thank the caller for the praises, but I want to take the opportunity to immediately pass on those praises to the rest of the healthcare workers throughout Grenada. It is only with the team are we able to achieve any of the successes. This is not a one-man thing. While people see the minister and the minister is a person that they will direct their criticism or praise, I believe as a minister, once there's praise, the praise has to be passed on to the team behind healthcare. And when there's criticism, I'll take the criticism and deal with it to strengthen the team.
And I'll just add to what the caller was saying. There's also a comment on Facebook asking you to continue doing a great job. And somebody on WhatsApp said they did an x-ray at the hospital yesterday and the service was excellent. She's impressed, or he or she is impressed with the machinery. So kudos to Minister Steele and the health team.
But that person that made that comment, I want to really thank that individual, because people hit the airwaves only when they have something negative to say about healthcare in particular. But very rarely do we see individuals hitting the airwaves to give congratulations. And that is not because that is a rare occurrence. People are going to the hospital daily and receiving proper care and proper service from our doctors and our nurses and our technicians throughout, and also to our communities, in our communities. And I think they need to be told as much as possible when they're doing a good job. In the same way that they need to be told when they're not doing a good job, we need to take the time to say thank you when we do receive proper service.
I have, before I go back to the phone lines, another WhatsApp question. Could you ask Minister Steele about training people to run equipment at the hospital? Is there a program ongoing for something like that?
Yes, there is, with respect to biomed or any of the new equipment that we get, the X-ray systems, for instance. That contract also includes training from the manufacturer. We have individuals who have been trained as biomedical engineers, and we also continually engage wherever the opportunity arises, where we have persons who we may have contacted to service some of the equipment. They also come to help train. But yes, that's a constant challenge that we continue to address and upgrade as we upgrade the facilities and equipment.
Good morning, caller.
Hi, good morning.
Morning, go ahead, please.
Is this a program with
Minister Steele? Yes, it is.
Hi, good morning to you. And good morning, Minister Steele. He's doing a very excellent job. God bless him. He tries his utmost best, and we cannot require any more. And God bless him, and all hats to him, and may he continue with the knowledge of God to guide him and lead him in the right direction as he's already doing. God bless. Thank you. Love you, Mr. Steele. Have a great day. Bye.
Thank you,
Thank you. And Blossom, again, let me publicly just pass that on to the rest of the healthcare team, and those blessings that she passed my way. Hopefully that they will bless all of our healthcare workers and everyone who is providing human service in the healthcare system.
There's a Facebook question. There are some health tests that cannot be done in Grenada, and from what I read, it seems like outside of COVID-19. There are some health tests that cannot be done in Grenada and has to be sent to Trinidad, but Trinidad's borders are closed and the tests are unable to be sent. Is there any negotiation that can be made with the government of Trinidad concerning these tests? The person says their father has been waiting on results or to send a test since May, and they are hoping to get it there at soonest.
Well, I know that our general hospital and the tests that we sent to Trinidad are with CARFA. And we have arrangements, and we continue to send tests daily to Trinidad. The governments have that arrangement to allow tests to go in. Now, I'm not sure what test the person is talking about and whether this is from a private entity to another private entity in Trinidad, or whether it involves the person's father going to Trinidad to be tested. But I would like to get some more information, and if the person can contact me at the ministry, myself or Dr. Charles, Dr. Sean Charles, at the Ministry of Health, so that we can deal with that. The reason that we are here is to make sure that those problems don't exist. So let me get some more details of that one-on-one with the individual. Blossom, if you have their number there and on WhatsApp, you have my personal number. You can give it to them. So we don't announce it on air, but you can give them my number so they can contact me directly so I can get more details so we can solve that issue for them.
I don't have the person's number, but remind me of the ministry's number, Ministry of Health.
Well, I would say we can use the hotline number right now.
Okay.
My number, I have no problem announcing it publicly as well, because as a first caller said, and they were trying to be rude, but I accept it, as a servant to the public, they can contact me or they can contact the Ministry of Health, most definitely.
Okay, so to the poster on Facebook, contact the Ministry, Minister Health, Minister Steele, or the CMO, Chief Medical Officer, Dr. Sean Charles, and they may be able to assist you in getting that test done.
No, we won't stop until we solve it.
Good. So keep note and contact them as soon as. Don't wait for the program finish. Call the Ministry now. And we quickly winding down. We did good this morning with questions. Let me see. There was another question on the WhatsApp related to are there plans to increase the number of nurses and doctors island-wide? Ask the nurses on the wards to pay attention to their patients, especially female medical. Are there plans to increase the number of nurses and doctors island-wide?
Yes, there are. We have started training of nursing assistants, and we are going to start the midwifery training as well. We also just recently awarded scholarships to individuals to go to Cuba to do nursing, and SGU Nursing School continues. There's another batch of individuals due to graduate shortly, and all of those individuals are being brought into the system. So yes, it's a constant ongoing local training of nurses, local upgrading of training of nurses with respect to midwifery and other specialties, as well as awarding of scholarships to individuals to go to places abroad where the opportunity arises, like Cuba.
As we wrap up, Minister, any final thoughts in relation to any subject at all related to health?
Well, just to say that we continue to manage the COVID threat fairly well. We have some tightening up, not just as a ministry or as a government, but as a nation. We all need to do our part. There are individuals out there who are ignoring the risks and as a result putting us all at risk. They are friends of somebody, brothers and sisters of somebody, sons and daughters or fathers of somebody, or neighbors. And it's not just for the police and the Ministry of Health to bring them back into line to conform, but it's us as a society to speak out and inform people that they cannot continue to keep putting us as a nation at risk. And also to say that while we are dealing with the COVID threat, and that seems to be on everybody's mind, COVID is not the only health threat that is out there. We continue to have threats from the vector-borne diseases like dengue, like Zika, like chikungunya. It's still around in the region. We have seen cases of dengue in Grenada recently and have been stepping up and will continue to step up our fogging and various vector control policies. But like COVID, we need to deal with this as a society, as a group, and not just simply pass the buck on to the Ministry of Health to deal with it. Like COVID, we need to make sure that our behaviors and our lifestyles are responsible so that we all do our part. So I'm asking that we as a nation do the same thing for any and all of our health threats. That includes the non-communicable diseases too, healthy diets, healthy lifestyles, exercise, eating the right foods, reducing the sugar and salt intake. All of these things are putting us at risk if we do not conform to it. And the general hope is that COVID taught us a lesson that if we adjust our behaviors with respect to any health threat, then we reduce, if not remove, our risk of that health threat. To end by simply thanking and congratulating all of the individuals within our health system who continue to provide human service, keeping our nation healthy. There have been callers that have called in and criticized individuals in certain areas, but I think we as a health group, as a health community, will self-correct, will adjust. And my hope is that those individuals, those very few individuals who do not provide the best service to the public and give the health system a bad name will adjust, or that we will create opportunities for them to be trained and upgraded so that they can provide the proper service. But congratulations to all within the health system.
Minister Steele, I know I said that was the last question, but my memory just kicked in. In relation to the COVID-19 control bill, it was not brought before Parliament initially, but subsequently we saw a news release that the plan was to take it before Parliament next month, God willing, pending consultations. Can you give us an update how the consultations have been going, the contributions via email and so on and so forth, and is the plan still to take it before Parliament next month?
The consultations continue, and from those consultations, for instance, last week we brought a bill, an amendment to a bill to the lower house, which, if you look at what was brought there, would have been part of that original COVID-19 regulation. So there is it's quite possible as we move forward in the consultation. I want to thank the Bar Association and the other stakeholders who have been actively involved in the consultation since then, to find solutions. And the solutions may not necessarily be coming back with that bill in its entirety, but the solutions as they are, as it's happening, may be a series of small amendments. And the hope is maybe not much at all if we all conform. But it would be necessary to bring some form of adjustment to the legislation and regulations. We as a government hope that it is as minimum as possible, but we will achieve that with the consultations. I have every faith right now, based on the interactions we've been having between our Attorney General's office and the drafting office, as well as the Bar Association and the other stakeholders, that we will achieve that goal to protect our citizens with the right acceptable regulations.
All right. Thank you very much, Minister Steele, for sharing some time with us today. We appreciate it. Thank you so much for the update.
No problem. Thank you very much, Blossom, and to all of your listeners and to everyone who has contributed with their questions or comments. And so, no, there was no, as far as I'm concerned, all of the contributors, I'm grateful for it, afforded me an opportunity to address any issues, regardless of their intentions in their contributions.
Continue to stay safe and keep us safe as well in the process.
Thank you, Blossom, and
Thank you. Have a good one. That was Minister of Health Nickolas, Steele, our guest this morning. I know there are still questions and phone calls that I haven't gotten to, but in the interest of time, I have to end the program. We've already robbed a few minutes out of mid-morning buzz, but there are things that I think we needed to share. I can't rob anymore. The minister needs to get back to his duties, and I need to hand over the reins here at Classic. Thank you guys so much for tuning in to The Point. I'll be back with you tomorrow, God willing. Actually, I'll be around for a little bit more during mid-morning buzz until Janelle gets into the studio. But have yourselves a productive Wednesday. Be safe, take care of yourself and each other.